Hello everyone, Dr. John Bartemus here for your Functional Nugget. I had a subscriber on YouTube ask if I would cover carpal tunnel causes and treatments. So carpal tunnel can occur in one hand or both. And to be specific, if we're talking about carpal tunnel, we're talking about median nerve entrapment at the carpal tunnel medically is what we're talking about. So if you have numbness and tingling and weakness in the hand, if you go to a medical doctor or orthopedist, they'll probably look for carpal tunnel syndrome, which is the median nerve being entrapped in the carpal tunnel here. And commonly they'll surgically snip the retinaculum that covers that makes the roof of that tunnel in hopes to create relief or space for the nerve to stop the compression and relieve the symptoms. The problem is that often that doesn't help, especially in people who have it bilaterally. So if you have carpal tunnel syndrome or numbness and tingling or weakness, especially in these fingers, then we're considering median nerve. If it's in one arm, then we want to look for entrapment, and the three main entrapment sites of the median nerve are going to be the ligament of Struthers behind the elbow here, the pronator teres muscle, and or the carpal tunnel here. If you have the surgery and it doesn't relieve the carpal tunnel and it's one-sided, then we definitely want to look at the pronator teres and the ligament of Struthers all the way up the arm into the neck, where the nerves from the neck leave and head down the arm to innervate everything. There can also be compression up in the scalene muscles from the pec and other areas, first rib, other areas. If it's bilateral, then now we need to think about more of a central cause, so more of a neck degenerative cause, neck trauma cause, poor postural cause, contributions from sitting at a desk and that ergonomic contributions. And then metabolically, thyroid dysfunction has been connected in the research for years to carpal tunnel syndrome. So if you have bilateral carpal tunnel syndrome, you've had bilateral surgery and not received any help, and you're also having signs and symptoms of unhealthy hair, skin, nails, can't lose weight, fatigue, cold hands and feet, then maybe your carpal tunnel syndrome is a symptom of thyroid dysfunction. And then that would need to be addressed to help the carpal tunnel.